is an item flow which is actually also one common item flow in our exams. Take this example. Which one of the following has helped most to increase the length of human life? Again, which of the following is very common in our exams and it is not advisable at all? So, what's the problem? What is the problem? You will laugh. When you finish reading all that, you will laugh at this. Of course, A. Oh, it's impossible. Yeah, you are putting an option which is impossible. Nobody will think of this. So this is, by the way, this is an extreme example maybe. But sometimes you put implausible options, which is not impossible, but it is very clear that it is unlikely. But this is not required because multiple choice questions, you give the question with multiple choices. These choices must be chosen by some students. That is how to differentiate between those who learn and they achieve the objective and those who don't. So you have to use plausible choices. Otherwise, you come up with an instrument which is not valid for measuring what you want to measure. Okay. A biologist who specializes in the study of the relationship of an organism to its environment is known as an. Have a look at these options.
It's very clear, very clear.
So but this any of us can actually commit this type of mistake. You know why? Because our tendency is to care for the correct answer. Because you are having the correct answer in your mind and you want to put it, you put an N, and subconsciously sometimes. Because you are caring for the correct answer more than for the other options. So again, grammatical cues. These students are very smart, they can make use of these grammatical cues. And again, using this type of question, ending with this semicolon, very commonly used, at least in the Faculty of Medicine I know, in our case it's commonly used, and even at other colleges. This is not required at all. What is required is you have to end up with a question mark, you have to end up with a very clear question. Putting it like something to complete the sentence is not required. And this is actually has been found by research that 10 to 15% of the students or of the responses will be affected by using this type of question. So this by itself is an item flow. Not having a clear question with a question mark that poses to the student a very clear question. Take this example. Okay, we don't want to waste a lot of time in reading but you can see the options. So, intravenous administration of this kind of scenario. And these are the options. What do you think about the options?
First three is excluded.
Yeah. So, yeah, it doesn't need a lot of thinking. He's asking about intravenous administration of something, and he's giving these some of options which are not homogeneous. So, logically, they know. They know that you mean either phenytoin or diazepam. They know. I'm sure we don't know the answer of this. I don't know the answer. I don't know what it means. But it will illustrate clearly what this type of item flow. Strong Campbell vocational interest plan is used to measure. It's an instrument for measure, but used to measure what? These are the options. Who knows the answer? I'm sure all of us, we don't know the answer. I don't know the answer. I don't know what is it. But you, me, all of us are experienced of not only putting MCQs, on answering it also. So what do you think the answer is? No, I'm sure you know. Interest. Very good. Very good. Interest. Why? Because it is repeated. The same word is repeated in the stem and the options. And it is clear that this will be the correct answer for sure. Using this repeat of these words is very common, by the way. It's very common. And sometimes, even if you don't repeat, but you are using a typical textbook word or description in the stem, then the student will come to the answer also very quickly without knowing the real answer. For example, it's common in medicine, used, presented with retrosternal chest pain, picking the same textbook word. And every student, they know that you are talking about myocardial infarction for sure. If you are asking about diagnosis or management or investigation or whatever. Yes, another example. So the question is about this symptom of experiencing the world as unreal. What is the correct terminology used for this symptom? These are the options. What is the answer? Without knowing it. I don't know it. I don't know the real answer, the correct answer, I don't know. But I can come up with this answer. Yes? I'm sure you know it. I'm sure you know it. Yes? Yeah. Got it, yes. Unreal in the stem, world as unreal. And derealization. It may not be the exact word, but the exact meaning. Still, this is an item flow. So the student may know the answer, they pick the correct answer, but actually, you are not measuring what they learn. Severe obesity in early adolescence, again using semicolons, which is not advisable. No question with a question mark. This is not the rule. But look at the options also. What do you think might be the problem? Do you know the answer? Can you reach a correct answer, even if you don't know? Yes? By exclusion. What can you exclude without knowing any answer? What about C? Always has a 75% chance of clearing. Is it really, this is real life? This is usually in life, it is not like that. In medicine, it's not like that. Always, without exception, look at D. Never, cannot be, impossible. Never, always, No, this is not. And even, yes, usually, how do you interpret usually? How do you interpret often? These words should not be really used because they are very much misleading. They will exclude the absolute terms like always and never will be excluded. And if you use the other terms, these terms actually are not fair to use them because if we ask any group of you, you will interpret it in different ways, usually, often, and sometimes. Look at this question also. This patient, certified Muhammad Umar, admitted at emergency at Central Hospital at 11 a.m. And then look at the options. So many problems. But the outstanding problem here, the most important flaw here is, what is the meaning of 35 years for answering this question? Has it any place? What's the meaning of Muhammad Umar? Why we are increasing the time reading for the student? It has nothing to do with the answer of the question. It has no role. It is nothing to play. You are just putting more words, more reading. More time is spent for nothing. And even the emergency department and at Central Hospital, at which time, these are, and junior doctors. Really, this judgment is non-professional. It is non-professional, at least. Why you are judging people, saying junior products? And there is no need, actually. It's not related to your question. So, you can ask directly about salbutamol, whatever you want to ask, directly. Some people, they think that when they design a scenario, they are making the question applied question, application. This is not true. This is the proof. It is not true. Still, it is just recall question, which is not very much advisable. If I am running short of time, you can tell me. Please. So this is unnecessarily long step. Unnecessarily long. It is not very long actually, but it's unnecessarily long for no any reason, for no good reason. Look at this stem. The stem is no question and not ending with a question mark. But look at the options. We cannot waste our time even reading this question. I don't know about the students. But this is really very much disturbing. Reading all these times. No need to do it. It's not advisable to use such questions. Especially if you are using English. We are using English for, this is the second language, and you know the problem of language. Have a look at this one. Well, he's asking about diagnosis of Epstein-Barr virus. And he's using these type of things here. Viral caspid antigen, IgM, IgA, immunoglobulin, and he's using Epstein-Barr nuclear antigen, and he's giving a key again. He wants to assign 1 for this one, 2 for that one, and 3 for the other one. Look how is this really complicated. Why it is complicated like this? And look at his options, because he has to use it this way. He has no other way. He has to use it this way. Number 1, 1 is negative, 2 negative, 3 positive, 1 negative, negative, 3 negative, this one positive, negative, and like. So really, the student will take a lot of time reading this type of complicated question. And they will not reach the answer easily. It needs a lot of reading interpretation. You are measuring the reading interpretation. You are not measuring the knowledge about how to diagnose nucleus mononucleus or Epstein-Barr viral infection. You are not measuring this. So again, this one, the same. The same one. Long options. Now, these complicated questions, which has got this complex sort of wording, actually, it is a test of reading comprehension. It is not a test of your course. Look at this question. This is STEM. So the STEM is, what is the likelihood of this patient having another child with a similar condition, which is Down syndrome? Yes? You can guess what's the problem in the options, yes. These are the options. So the possibility is 2%, 5%, 35%, less than 10%, 10 to 18%. Really? Poor students. They will not really, what do you mean by 2%, 5%, and less than 10%? How can they differentiate between these three options? So, and you are using here, what is used is, you are giving this absolute numbers, and you are using range also. Even you don't stick to one format in the question. Really, these are flaws which they really defeat your exam as a. Look at this example. Giving this scenario for a 1 month infant with this condition, giving symptoms, how he presented, and some of signs maybe, and okay, I'm finishing almost. So, you see how it is mixed. It is caused by so-and-so. It is due to so-and-so. It is related to insufficient fluid. It's rarely lasts beyond 3 months of age. Its sedation is usually effective. Ferris, it is heterogeneous. It's not talking about, it's not homogeneous. And the other thing is that it is, yes? Sorry. And the other thing is that of using rarely, using usually, is also a problem. Sorry, this is a question also. In this question, it is also heterogeneous, mixed, and in this one, they are not put in logical order. It is required that you use logical order, for example, alphabetic order, at least. Or for the numbers, for the numeric data, you can use descending or ascending order. It's better. And yeah, this is important. Not a feature of, and using in the option also, no increased risk, no real anomalies. Double negative in the STEM, this is very dangerous item flow. And even double negative is even worse. And yes, that causes, yes, this one. All of the above? None of the above?
None of the above, all of the above, same question.
And in the same question, and even if it is one, it is also, you know what is the test-wise student, how they interpret it? All of the above, always true. Most of the time. None of the above, always wrong. Most of the time. They don't think of any other thing. Or even if they want to